Hospitals across the country are facing nursing shortages. Nurses in Minnesota this past week organized the largest strike of private sector nurses in U.S. history, with 15,000 nurses walking off the job for 3 days. And while the pandemic pushed many nurses to the brink, some say the burnout was years in the making. Joining us now is Kelly Annas, one of the nurses from the Minnesota strike, and Jean Ross, the president of National Nurses United. It's good to have you both with us. And Kelly, you were out on the picket line with your fellow Minnesota nurses this past week. What were you all demanding from hospital management?
Well, the focus of our contract campaign has largely been around the staffing that has changed in the last, even pre-pandemic, the last few years, in hospitals around the state of Minnesota and truly around the country. That has been the largest part of the focus of our strike. Also, issues like paid family leave, workplace violence and protections around that, and also compensation for nurses.
So, Kelly, I understand that you've worked at the same hospital for some 14 years now, including a
Yeah.
stint in the ICU during the peak of COVID. What choices do you think the hospital made that contributed to this tipping point where nurses feel no other option but to hit the picket line?
Even before COVID showed up in America, in Minnesota, um, our hospitals started implementing this process they refer to as benchmarking, where they would compare their staffing levels to like hospitals around the country and then work to match the staffing levels. So in most cases, they dropped the staffing levels, but doing the same amount of work, taking care of the same amount of patients with the same or even higher levels of acuity. Then, when the pandemic showed up, they staffed us up. We were more prepared to respond to critical patients and their ever changing levels of sickness. Um, and we were able to take breaks and go drink water and eat and rest and kind of do those things so that we could kind of refuel and get back into the room taking care of our patients. As COVID kind of became part of the norm, both in the outside world and inside the hospital, they started reverting back to these lower benchmark levels of staffing. And so we went back to doing more work with fewer resources that we'd seen before.
So, Jean, what are the possible solutions to this nursing shortage? And what's preventing hospitals from pursuing the solutions?
A very simple way to fix this is to listen to the nurses, to respect them enough to respect their judgment. You need to pay people for their worth, and I think you saw our worth clearly during the pandemic. You need to pay the nurses enough that they will stay working even during a pandemic and will attract other nurses into it because it's a wonderful career. The kinds of things that Kelly mentioned that helped us during the pandemic were things that the employer did not easily give us. We had to fight. We had to go to the governor. We had to go to the president. We had to go to the CDC and OSHA. So everything we've got, we've had to fight for. And we know what nurses need in order to keep our patients safe. The employer needs to listen to us, needs to acquiesce to our needs for good staffing and for adequate compensation.
Jean, we reached out to some of the hospitals to get their response to this. And a statement that we got from one of the hospital systems, they essentially said that they were deeply disappointed by the nurses union's choice to strike before exhausting all efforts to reach an agreement. What do you say to people who might agree with the points that you make, but who would also say that by nurses striking, that really put patients at risk? What's your reaction to that?
If you don't stand up for what you need for yourself as a nurse and for patients to keep them safe, that's putting patients at risk. When you do nothing, you're part of the problem. It's very, very hard for nurses to walk out on leave their patients. We don't know what kind of care they're getting, and they certainly don't know our patients. We are the best people to provide that care. So when employers say, they're disappointed, well, we have a lot more than disappointment going against them too. We are totally disgusted, quite frankly. They're making money hand over fist despite what they say. And quite frankly, if you can't afford to pay your people to bring them in and keep them, maybe you should be looking at a different line of business.
Jean Ross and Kelly Annas, thanks so much for being with us.
You're very
Thanks for
welcome.
having us.